Hello, this is Dr. Gay from First Look MRI, and I'd like to show a few images of a patient who has a tear of a component of their medial collateral ligament. It's a good example of some of the anatomy here. So the medial collateral ligament, or the MCL, has outer thick fibers, here they are right here, coming off the femur down to the tibia. And again, these are the outer fibers, very thick, and then there are inner capsular fibers that are part of the joint capsule, and those are adherent to the meniscus body. And usually the outer fibers and the inner fibers are just glued together, and also the medial meniscus body is glued. So usually they're a continuous band of the MCL and the meniscus. So on this view here, we see there's brightness between the capsular surface of the medial meniscus body here. This brightness here is abnormal. And so we look to see, well, what is torn? Well, the outer fibers look nice and good, and then the inner capsular fibers are bright, so we know they are injured, and this is a possible meniscocapsular junction separation. But if we look here, we can see the inner capsular fibers, part of the joint capsule comes up here, and it blends with the peripheral rim of the meniscus. As we go up here on this view, we can see it continuing on up, and it ends right here. So this is the inner capsular fibers, or the inner component of the medial collateral ligament, and it looks like it's intact down in the tibial side, and it's intact as it attaches to the meniscus body. But up here at the femoral attachment, it is torn and pulled down. So this is a tear involving the inner capsular fibers of the MCL from the femoral attachment here, and again, the component to the meniscus body is still intact. This patient incidentally had an ACL tear and typical bone contusions, a little radial tear of their lateral meniscus here. And that's it. Thank you very much.